Good day and welcome. My name is Terry O'Brien. I'm president of First Benefits Group, Inc. We're located in Sarasota, Florida. We spend a lot of our time working with clients on Medicare and making the right choices. We think those choices are important, making your best decision on Medicare. So we thought today that we would create a webinar so that you can understand the basics of Medicare without going through endless research of mountains of paperwork or looking at all the mail that comes in and says choose us for your Medicare selection. So we're going to get through that maze and we're going to talk to you simply about Medicare and what your options are. So let's get started. One of the most important things is that for most people, you only retire once, so get it right the first time. The decisions you make today on Medicare may have to last a lifetime, so it's important to get it right the first time. So who is this workshop for? People who are joining Medicare in the next 12 months. For most Americans, this is people that are age 64 and are turning 65 within the next 12 months. People that are trying to understand Medicare and their options. We've had a lot of people come in over the last year and said, you know, this whole Medicare thing is very, very confusing to me. I don't understand anything about it. Can you help us? Third part of this is we want people to make the best decision on the Medicare strategy. And the best way to do that is to be educated. So what's my goal for this workshop? Well, number one, we want to take the confusion out of Medicare. Number two, which is really important, we do three things. We educate, educate, and educate. And we help understand your needs and work with you on creating your best strategy that's for you and not the insurance companies. Medicare is a maze of confusion. You enter here, you enter, and you leave at the end. We're trying to make this line as straight as possible, as easy as possible for you. What we'll cover in Medicare? How and when to enroll in Medicare? The different parts of Medicare, there's 4 parts. Original Medicare plus a supplement versus the Medicare Advantage plan. And the importance of making a sound decision when you are first eligible for Medicare. One thing I want to make a distinction about before we get started is the difference between Medicaid and Medicare. Oftentimes, people ask us, well, what is the difference between Medicaid and Medicare? And it's fairly simple. Medicaid, if you think about it, is state aid. It's underwritten, at least a portion of it, by the federal government, but it involves state aid, and it's usually designed for people that don't have a lot of income coming into their lives. Whereas Medicare is a federally funded program, and it's designed, as we mentioned earlier, for Americans that are turning 65. So enrolling in Medicare, you should enroll in Medicare Part A when you first become eligible. You may not need to enroll in Part B of Medicare if currently covered under a large employer-sponsored plan. If you have any questions about that, we suggest you contact your Human Resource Department to see if you need to enroll in Part B. Usually the Human Resource people are pretty well versed on whether or not you can waive out of Part B. But eventually, if you do go on Medicare outside of your employer-sponsored plan, you will need to enroll in Part B. Or enroll in Medicare if you have credible prescription coverage. So when do you join Medicare? Well, what the government says is that there is an initial 7-month enrollment period. The first 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So as an example, let's say that you were born on June 12th. You would sign up 3 months prior to that. You would be eligible for Medicare on the first of the month, so that of your birth year, so that would be June 1st. You can wait another 90 days if you elect to do that for coverage, and coverage always begins on the first of the month. There is one exception, which I find kind of unique, is that if your birthday was on June 1st or the very first day of the month, you would be eligible for Medicare on May 1st. If you were born June 2nd, then you would be eligible for Medicare on June 1st. So let's recap Medicare enrollment. We suggest that you complete your Medicare paperwork 3 months prior to joining Medicare. This is the time you need to get educated on how Medicare really works. If you have current group coverage, you check to see if you should enroll in Part B. We talked about that earlier. And you need to start researching your options on original Medicare plus a Medicare supplement versus Medicare Advantage plans. And we'll talk about those a little later in this webinar. So what are the parts of Medicare? Well, there's 4 parts. Let's start with the first one. It's Part A. And it includes hospitals, skilled nursing, mental health, hospice. And for most beneficiaries in the United States, there is no premium for Part A. Part B is another component. It covers doctor visits, durable medical equipment, lab services, therapy. And for most beneficiaries, the premium is $144.60 per month. If you're in a higher income bracket, they will apply a surcharge to you. What they do is they look at your 2 years ago tax returns and they look to see what your adjusted gross income is, and if it's substantial, then they will apply a surcharge. And that surcharge applies to both Part B and to Part D if you're enrolled in Part D. Keep in mind that Medicare Part A and Part B only covers 80% of the claims for Medicare. The other 20% in the light blue there is the one that you're responsible for. So we should talk about how do you cover the other 20% in Medicare that are not paid under Part A and Part B, and we'll talk about that. Part C of Medicare, it replaces the original Medicare by a private insurance company that was approved by Medicare. It provides both A and B coverage, and in most cases it provides RX coverage. It could provide additional benefits. The last time I looked on one of the Medicare Advantage plans, they offered vision, drug, and they offered a membership to a fitness club. So you need to look at those additional benefits that Part C, and a lot of the insurance companies, in order to entice you to join Part C, like providing these additional benefits to attract you. Now keep in mind that Part B premiums are always required even if you're in Part C. That's a very confusing idea, but you will have Part A that's no charge. Part B, there is a premium regardless of whether it's original Medicare, or if you're taking the Medicare Advantage plans, as Part C is called, you will also pay for the Part B premium. Part D of Medicare, it's easy to remember with the D because it stands for drugs. It's prescription drug coverage. It was introduced in law when George W. Bush was president. This is also held by or sponsored by private insurance companies, been approved by Medicare. They may lower your drug costs. There are many types of coverage and many spans of premiums. It's not required. Part D is not available with Part C. Part C is a standalone. Part D becomes with Part A and B. Late enrollment penalties apply. So if you think you're going to want to enroll in a Medicare, original Medicare, you want to make sure that you pick up a Part D because the penalties over a period of time become substantial. So let's recap the different parts of Medicare. Part A, Part B, Part C, and Part D. Keep in mind that Part A are for the large major claims such as hospital stays. Outpatient. Part B is for the minor claims such as labs and other items, durable medical equipment. Part C is a standalone insurance companies that take the place of original Medicare that take care of Part A and Part B. Keep in mind, you still need to pay the premium on Part B, regardless whether you're in Part C or you take original Medicare. And finally, the Part D drug program over here takes care of prescription drugs for people that enroll in the original Medicare. Let's talk about original Medicare and Medicare supplement. What the Medicare supplement does, and sometimes is referred to as a Medicare gap policy, we like to use it as terminology that actually provides a shield for over here. And what it does, because Medicare doesn't pay all the claims, the shield will pick up 20% of the claims that Medicare doesn't cover. Keep in mind, it's important to know that if Medicare doesn't pay the claim at all, your Medicare supplement will also not pay the claim. So it has to be covered by Medicare in order for the Medicare supplement to kick in to pay the balance. We liken it to a house. A and B are inside the house. A is the main framework. And then we put an umbrella over that, which is called a shield, that will cover all the claims. I liken it to a blanket over a house, or even perhaps an umbrella. Medicare supplement plans, often called Medicare gap plans, have 10 different plan designs, and they are all standardized by approval of the federal government. So when you look at a plan A from one insurance company to another insurance company, the coverage of benefits is identical. Keep in mind that Medicare Part B, the Medicare supplement plans all pay 100% of whatever is covered under Part A. It picks up the balance. If you look at this with a red, these are the areas that are not covered under the different plans. As you can see, Plan F, G, and N cover extensively. Most of the things that are covered are of the 20%. You'll need to know that Plan F is not available for anybody born after January 1st of 1955. The federal government felt that it was too rich of a benefit plan. Plans G and N are still available. Now keep in mind, if a claim falls under the Medicare supplement plan, you need to know that if Medicare doesn't approve as a medically necessary plan, the Medicare supplement plan will not pay for it as well. It has to be approved under the Medicare, original Medicare, before the Medicare supplement will pay the difference. So let's review what the Medicare supplement plan features are. The nice thing about Medicare supplements is it's nationwide coverage. So as long as the doctor is licensed as a Medicare practitioner or the hospital, they will accept your Medicare plan. There are no networks. There's no referrals needed. So if you want to see a specialist without seeing a primary care physician, you can do that under original Medicare. You can see any doctor, any hospital, but there is an additional premium that is required. And from time to time, insurance companies do raise those premiums while you are enrolled in a Medicare supplement plan. So let's take a look at the picture again. You've got your structure of A and B. The Medicare supplement acts as a shield or a blanket over whatever's not covered. And then the final piece of that is your Part D, which is your drug plan, which is completely separate and has a separate premium, but goes hand in hand with original Medicare plus a Medicare supplement. Let's recap. Supplement plans provide nationwide coverage without prior approval. Coverage plans federally regulated for all insurers. So when somebody says they're on Plan F, that plan design is the same for all insurance companies that issue that plan. Plans do differ by insurer, so you need to look at that to see which one is most cost effective for you. The other thing you want to take a look at, if it's available, is you want to look at the history of rate increases for premiums on Medicare supplements. You'll want to ask your agent or advisor for a list of the last 10 rate increases or the rate increases over the last 10 years to get an idea of the actual cost of the supplement. It's not exactly always right to think that the lowest premium going in is going to be the lowest premium long term. As we mentioned earlier, the decisions you make on a Medicare supplement may have to last a lifetime, so you want to make sure you have that information to make a sound decision about what's the most cost effective over your lifetime. That's a big item that's not discussed very often, but is very important. Premiums differ by geographic location, so if you decide that you're going to move from Michigan and you want to move to Florida, the Michigan rates are going to be different than the Florida rates. You'll have to contact your insurance company or your agent and let them know that you're relocating, and then they will reprice that premium. Smokers are usually charged a higher premium, so you're going to have to look for that if you do smoke. Most of the carriers do charge a surcharge on that. So let's talk about the Medicare Advantage plans. We spent a lot of time talking about original Medicare plus the supplement. Some of the pros of the Medicare Advantage plans is they're offered by a licensed insurance company and act as a substitute for original Medicare. The insurance companies must be approved by the Centers for Medicare and Medicaid Services. In most cases, RX is offered and it's included in the plan at no additional cost. Many Medicare Advantage plans offer additional benefits that are not covered under original Medicare. Medicare supplement plans do not offer, in most cases, additional benefits. What's nice about the Medicare Advantage plans, you have predictable and cost savings on the premiums because there is no premium, in most cases, charged on the Medicare Advantage plans. There is healthcare coordination with providers. You get all services under one roof, and you might have possible coordination among providers. Some of the cons on Medicare. RX may not be included, so you need to check it out. Plan D is not available with Medicare Advantage plans. Many Medicare Advantage plans have restrictions by region. If you decide to move to a different region, you may not be eligible for your specific Medicare Advantage plan in that region. A lot of providers may not accept Advantage plans. You have to look for that. So when you think you're going to have a service surrendered and the service may be significant, you're going to need to make sure that all your providers and the hospital are covered in that network. So there are some limitations in the network. In my community here alone, one of the major hospitals do not take all the Medicare Advantage plans. As a matter of fact, they just take a couple. So it is important to know which hospitals are available under a Medicare Advantage plan that you want to make a decision on. The other thing you have is that you're going to have deductibles, co-pays, and co-insurance. It operates a lot like traditional health insurance for people under the age of 65. So Medicare Advantage plans, everything is under one roof. You have A, B, and D. You have networks. You have out-of-pocket expenses. You got co-pays, deductible, and co-insurances. You have additional benefits. It's available. It's possible. No or lower premiums. So let's recap the Medicare Advantage plans. Medicare Advantage plans use provider networks, require prior authorizations for specialists and other care components. Even with low or no premiums, costs could be high due to deductibles, copay, and coinsurance. Medicare Advantage plans are offered by licensed insurance companies and take the place of original Medicare. Medicare Advantage plans may offer additional benefits that are not covered under original Medicare and with no additional cost. You also need to keep in mind that if you're in a Medicare Advantage plan, most of the insurance companies they're required by law to offer the same medical benefits that original Medicare offers. So now you know how and when to enroll in Medicare. 4 parts of Medicare, A, B, C, and D. Original Medicare plus Medicare supplement versus the Medicare Advantage plans. You have options. You have options in the original Medicare, and you have options in the Medicare Advantage plans. There are many different types of Medicare Advantage plans, and under the Medicare supplement plans, you've got 10 different plan designs to choose from if an insurance company offers all 10 of those plans. The main differences between the two strategies, Medicare plus Medicare supplement, and then finally versus the Medicare Advantage plans. So you have a choice. You got two forks in the road. Which road do you want to take? If you go it alone, it's time consuming, very confusing, longer learning curve, could potentially costly if you make a decision on which route to go, and it's painful. If you decide to go route number 2 and work with us, we'll be working together. It'll be more efficient, less confusing, got a much shorter learning curve. We have Medicare experts on our staff that have been working with the Medicare now for several years. Less chance of error because we've been down the road of mistakes that have been made in the past. We do our discovery, and we help you develop a strategy that works for you. The bottom line would be cost efficient, and we'll help you make sound decisions. So let's get the maze of confusion off the table. We can start you there. We can get this line as straight as possible so that we can make this as less painful as possible. We want to make the right decision for you, not the insurance companies. So let's talk about your options. You have 3 options when working with us. We try to make it as easy as possible. We're just a phone call away. Our number is 941-361-3057. You can contact us. You can. All of us are very experienced in Medicare. My extension is number 4. We can assist you. We can do a Zoom meeting online if you prefer that, or you can make it a personal appointment in our office if you want to have firsthand experience in working with us and meeting us face to face. We do social distancing here, so we practice very safe COVID practices. We have 4 objectives. We help you with the Medicare enrollment process, so if you need some help in Medicare, we get a lot of clients come in and say, I don't even know where to begin with enrolling in the process. We'll walk you through the enrollment process. We can do that Zoom right online. A little tougher by a phone call, but we can also do it on a personal appointment, but that's your choice. We'll identify your healthcare needs, and we'll match appropriate plan options, and we'll find a plan to meet your healthcare and budget needs. So there you have it. We do have one additional thing, and it's very important and very significant, and we call it the bonus. It's your own personalized Social Security report. That bonus report is worth about $295. It's a 10-page information packet report, including the estimated amount you'll receive when you decide to take Social Security. When is the earliest you can take Social Security? What's the optimal time to take Social Security? We get a lot of people that come in just for this very reason of, tell me what the optimal time to take Social Security. It gets a little confusing when if you have a spouse involved, and especially if there's some differences in the ages. So what we do is we work through looking at all your options on the optimal time to take Social Security. This is a bonus if you decide to work with us. We'll waive the $295 fee. You can take it with you and use it. We review it with our clients on a regular basis. The other thing that we look at is how much you're going to receive over your expected lifetime. And I think if you've been working most of your life, you'll be surprised at the amount of money you'll be receiving between now and your lifetime. We ask what you think your expected lifetime might be so that we can plug these numbers in so we can figure the optimal time. This bonus is a $295 value, and you'll be working with me directly on that. We'll need some input on some information before we give you the Social Security report so we can make this accurate and very timely. So take a look at the number below, the email below, and jot us a note. Tell us you want to set an appointment, and we'll start working with you. We're located in Sarasota, Florida. We pride ourselves in being pioneers in healthcare and financial strategies. Give us a call, set an appointment. We'd love to talk to you. Thanks for listening to this webinar, and I hope you found it useful.